we've spoken a lot about endocrine issues, and these endocrine issues, because we are an obstetrics and gynecology channel, we have always tried to link them. Like, okay, occurs in pregnancy, what will happen? All right, if it occurs in pregnancy, what will be the complications? So that has always been our push. So for next thing, we are talking about hyperparathyroidism. Of course, hyperparathyroidism means the parathyroid hormone is producing too much. The parathyroid gland is producing too much parathyroid hormone. So parathyroid gland is those 4 glands that are behind the thyroid gland. All right, so they're actually right here. So if it occurs in pregnancy, okay, what would be the complications? Of course, pregnancy is always a special situation. All right, so hyperparathyroidism in pregnancy is rare. To see a pregnant woman with issues of the parathyroid gland is basically a rare thing. Do you understand? But if at all you ever see it, it's dangerous. Okay, it's potentially dangerous. She needs a lot of attention and all of that. So it poses a lot of risks, and these risks can be subdivided towards the mother, and there could also be risks on the baby side. So most of the times it's because the mother has had this issue before she became pregnant, you know. So on the mother's side, the mother can be having hypertension. Her blood pressure is so high. Okay, the mother is having pre-eclampsia. Well, pre-eclampsia is hypertension in pregnancy, you know. She's vomiting so much, that's hyperemesis gravidarum. Nephrolithiasis, she can develop what, kidney stones, right? She can develop inflammation of the pancreas, right? She can develop high calcium levels in the body, you know. So what next? HELP syndrome, right? That's hemolysis, elevated liver enzymes, then low platelets. Okay, so on the baby side, it can lead to miscarriage. It can lead to you giving birth to the baby before they actually reach maturity, right? Neonatal seizures, okay, then permanent hypoparathyroidism. So because the mother had high hyperthyroidism, hyperparathyroidism, the baby is having the opposite. Then you give birth to this baby and their weight is not up to, you know, the weight in which you should expect. Then their bones are also weak, all right, because they have hypoparathyroidism, and the parathyroid hormone initially should stimulate what, formation of strong bones and all of that. You understand? So you have all the issues. So diagnosis is just simple. I'm trying to check out for what, calcium levels. Okay, I'm also trying to check out for what, parathyroidism hormone levels. Parathyroid hormone levels. You understand? Then you do imagings just to see if there's any abnormalities inside. So management is for the mother, if parathyroid hormones are getting so much, and maybe it's because of a tumor growth or something, right? They might just remove the parathyroid hormone, right? Medical therapies, right? They rehydrate you, you know. Then sinacalcate, all right, calcitonin, okay, then all of that. Okay, so this is just what, that's just the complications for this disease condition, if at all it will ever happen in a pregnant woman.